Dr. Jones checking in. This is A&P 2 lecture test 4, video 2. So we're talking about respiratory now, and we finished pages 2 and 3 for the note set. So we're starting at the top of page 4, or if yours printed differently, here, 23.3, the larynx produces sound. So we'll talk about this part next. So the glottis is the opening in the larynx. It's this kind of space here. There's not really a great picture of it. The better picture is kind of here. It's one of those weird things where the lecture and lab books are kind of in between the new definitions. The previous version is that the glottis was just the opening, and the new version is more that the glottis includes all of this. And on this next picture, you can see that it says the glottis is like this whole region, whereas the remiglottitis is the opening. And we used to call, in the previous version, the glottis the opening. And now the glottis includes the vocal folds and this whole, the vestibular fold, this whole kind of region. So... but we have updated lab to include these terms. So if in lab they ask for the opening, usually in the lab model it'll have a stick in it, then they're looking for the term remiglottitis. As a lab review, glottis has 2 T's, and all the versions of glottis have 2 T's. Remiglottitis has 2 T's. Glottis has 2. All right, so glottis. And the larynx is this whole shebang, which is the voice box, which includes the glottis, which includes the remiglottitis. So it is. So pharynx, larynx, what's the difference? The pharynx is the throat, specifically the back of the throat that we drew in on the previous video, and the larynx is the voice box. So larynx, and then the pharynx opens into the larynx. Well, the laryngopharynx, because the larynx-pharynx. We talked about that. And lab notes. Again, anything from lab that you don't recognize in that section, write it down and memorize it, because that is both lab and lecture material. You are responsible for all of that. Now, some of these terms that aren't lab terms for us, like the ligaments, the little parts of the hyoid bone, the parts of the cartilages that aren't on our lab list are not lecture material, although you should know this cricothyroid ligament. Let's change colors. And we're going back with red. You should know this cricothyroid ligament, which is between the thyroid cartilage and the cricoid cartilage, because if you were to need to cut into someone's throat and put like a big pin there so they were choking, couldn't breathe, heaven forbid we ever need to, but if you were to need to, is what you're aiming for right at the bottom, there, a little kind of round spot, and that's where you put something to keep the airway open. A little tube, straw, firm straw. Okay. Sounds and speech. All right, so the vocal folds vibrate. That's how you talk. That's how you make noise. And making noise, the sound production is called phonation. And that's the just the making noise part of talking. So turning those phonations into speech is called articulation, and that involves the mouth, the teeth, the tongue, the lips, and but, okay, all the different sounds that you make with your teeth and tongue, lips and tongue on the teeth, are turn the phonation into articulation. Ah versus la la la. That's how that works. Laryngitis is inflammation of the larynx. The vocal folds, when they vibrate, when you tense them, that increases the pitch because it lowers the wavelength of the sound waves. So the more tense, the higher the pitch. And then when you relax them, that makes a longer wavelength, which makes a low pitch. So that's how you do that, is by, you have little muscles in here that put more or less tension. Here's what it looks like IRL. Put more or less tension on these little vocal folds. And that's how you change the pitch of your voice. So that's why. Oh, and then acute epiglottitis, again, 2 T's, and then itis has a T also, obviously. So sometimes a bacterial infection can swell the epiglottis shut, and the epiglottis, again, 2 T's, is this thing here. And if that swells shut over this opening, then, and this is most likely to happen in children who have smaller glottal openings, then the child can suffocate of that acute epiglottitis. It usually does happen startlingly fast. So the trachea is the wrong pipe. If it has gone down the wrong pipe, it has gone down the trachea. The benefits of a C-shaped cartilage. Okay, so the cartilage here is C-shaped, so you know. And there's the trachealis muscle in the back. That's a lab term. The benefits of the C-shaped cartilage. So you can see here in this drawing of the esophagus that when it is empty, it is closed. And then as you swallow, the bolus of food will push it open, and then it closes again behind the food. So in the absence of this cartilage, the trachea would similarly be pushed shut. And then you would have to gasp with each breath to open the trachea enough to get air through it. And so one of the benefits of the C-shaped cartilage on the trachea is to keep the tube open for air movement. The other benefit is that when you swallow, behind this esophagus is the vertebral body. And so it's a hard place, not between a rock and a hard place, but there's the hard place. And so when you swallow food, this opening here allows the esophagus to swell into the lumen of the trachea. It allows it to push all of those tissues forward as you swallow. As you're swallowing food in your esophagus, you're not breathing through your trachea, so you're not using it right at that second. So, 2 reasons. Oh, and of course it protects the trachea, yada yada, keeps it open. Okay, the carina is this little speedo looking bit at the bottom, and that is where the trachea split into the main bronchi. Now, the main bronchi in lab are called the primary bronchi, and now they are called main bronchi, and this is a new change in terminology. So, why do most foreign objects make their way into the right lung instead of the left lung? Because the right main bronchus is bigger in diameter, so more stuff fits in the right side than the left side. And also the left side veers off at a sharper angle, and so things tend to just roll down into the right lung. So that's why. And the lobar bronchi here used to be called the secondary bronchi. And one goes to each lobe of the lung. We haven't said yet, but unless you've watched the lab videos, the left lung has 2 lobes, and the right lung has 3 lobes. It's partly Okay, mostly because the heart, which does cross the midline, sits towards the left of the chest, and it takes up some of the space where the lung would otherwise be. So the left lung is slightly smaller than the right lung, and the left lung only has 2 lobes, whereas the right lung has 3. And we will name those lobes and the lines that separate them. Lecture and lab. And then the segmental bronchi, is that on this picture? That is not on this picture. Next picture. There we go, segmental bronchi. The segmental bronchi used to be called the tertiary bronchi, and they go to each segment, each bronchopulmonary segment of the lung. So there are 10 in the right lung and 8 or 9 in the left lung, depending on how you were put together. Every body comes factory assembled a little bit different. And then bronchitis is inflammation of the bronchi or bronchioles. Next, did I turn my timer on? I thought I turned the timer on. I set up the timer but didn't turn it on. Should we do the next page? Nah, I think we're going to call it here and start back on this page for the next video. So this has been A&P 2 lecture test 4, video 2, covering Noteset page 4. Thank you as always for tuning in. The education must go on. Dr. J out. Command, Control, Escape. Thanks, y'all.